Hello, I'm Dr. Sarah from the Shriners Hospital for Children in Philadelphia, Pennsylvania. You're probably watching this video because someone you love has been recently diagnosed with clubfoot.
Clubfoot is a foot abnormality affecting about 1 in 1,000 babies born. Every day, we treat children with clubfoot to help make walking as easy as possible for them. In clubfoot, the affected foot is stiff and points down and inwards. Most of the time, the cause is unknown and not usually associated with any other problem. However, sometimes clubfoot may be associated with different diagnoses like hip dysplasia, arthrogryposis, and myelomeningocele. Clubfoot is a condition that will not get better on its own. If untreated, a child may grow to walk on feet that look almost upside down. Early treatment is highly recommended for clubfoot patients. The goal of treatment is to stretch the foot into a position which is better for walking. The younger the child is, the more flexible the tissues in their foot are, and so it is easier to treat babies, but older children can be treated successfully too.
Treatment involves 3 stages: casting, possible surgery, followed by bracing. Your care providers are responsible for performing the first 2 stages. The last stage of bracing is only successful with your active participation. We start with the Ponseti Technique, which is the most common method of treating clubfoot, and it is used all over the world. This technique uses casts to stretch the foot into a better position, and a new cast will be applied once a week for a month or more. In most cases, at the end of the casting series, the doctor will perform a procedure to lengthen the tight heel cord. This can be done in the office or in the operating room, followed by a final cast which is applied for a couple of weeks.
Listen carefully. This is the most important part. Even though at the end of casting series we have the foot looking great, there's about a 20% chance that the deformity will come back. Children with syndromes may have a much higher rate of relapse. An effort to prevent the casting series is always followed by bracing. The number one reason for a recurrence of deformity is failure to brace properly. Your understanding and ability to brace is the only way to ensure a great outcome. You are so important to achieving the final perfect foot result. Your child would be fitted for braces either before or after their last cast is applied. Bracing will help keep the foot in the corrected position and prevent the tendency to return to the position it had been in before.
Here is an example of a clubfoot bracing system. You may hear this referred to as a Ponseti brace or Mitchell brace. This brace consists of 2 open-toed leather boots connected by a metal bar. This bar may be fixed or movable, depending on your doctor's recommendation. This brace externally rotates your child's feet, holding them in the corrected position. As your child grows, the boots may need to be replaced with a larger size, and your bar will be adjusted. So please make sure to bring this with you to every appointment.
This is the brace, 2 boots attached to the bar. When you go to put them on, typically I would have socks that go all the way up to mid-calf. The most important part is bending the knee, getting that heel all the way back to the back of the boot. There's a window on the side here and on the side on the inside so that you can see that the heel is all the way back. This piece goes over the top of the shoe, and I find it easier to do the center buckle first. This is the most important one anyway. This has to be the tightest part of the boot, and you can see, you can even mark it to where the tightness needs to be depending upon the foot. As long as it's to that mark or tighter, you know the foot will be in there. The second one I like to do is the toes. That one's marked as well. He typically can go a little bit tighter and pull it through there. And then the last thing you can see is helping over here. And then the top of the boot. And we have that one marked as well. You would do the same thing. He's so used to this that he helps usually put the second foot in. This is nice with having the window on the side because now that this one's done, you can still see that the heel is all the way to the back of the boot. And then you'll just repeat on the other side. Make sure that piece is over. Center strap first. Tighten it to the mark or tighter. toes are the second piece. And then you'll finish with this one. If your socks extend up to here, like some of mine do, I like to then fold them down over the top buckle just to keep everything together. There you go.
Here are some examples of AFOs. AFO stands for ankle foot orthosis. AFOs are custom made from plastic depending on your child's specific needs.
To apply the brace, you first hold your child's foot with the toes pointed up and slide it into the brace until the heel is all the way back, but the toes remain showing out of the end of the brace. Sometimes this is a little easier to do if the knee is bent. Tighten the straps until they are nice and snug. The strap that goes over the ankle is the most important. This strap will prevent the heel from slipping out of the brace, which could cause relapse and allow the foot to point down.
She's a little stubborn, so she don't like to wear her braces all the time. But I think it's every kid, they don't understand why they're wearing braces. So her feet recurred several times back. But now that she's older, she understands that she wants to walk normal like everyone else and play for her brother and sisters. So
in the brace, make sure they stay in the brace. Make sure it's put on properly. Make sure it's tight. The night brace, make sure that's put on properly. Just follow whatever the doctor orders are. That's the best thing. Follow the doctor's order.
Typically, children wear their braces full-time at first and only remove them for bath time. After that, the doctor may shorten the duration of brace wear to nights and nap only. Bracing will likely be necessary for several years. Kids will need replacement braces in bigger sizes as they grow. The main reason that relapse occurs is because the child fails to wear their braces properly. Children who relapse tend to have worse outcomes. Braces are the key to maintaining correction. Using braces will not slow down your child's development or ability to walk. Not using braces may lead to relapse, which may need even more surgery to fix. Children in casts and braces can still attend school or daycare. Everyone who cares for your child needs to understand the importance of bracing. You may want to teach others how to apply the braces in the event that your child takes their braces off.
We hope now that after watching this video, you feel more confident in how to apply the braces and why they are so important. Your participation is key to your child's success. Please ask your provider if you still have more questions. We wish you the best of luck throughout your child's clubfoot treatment.